Hello, guys. Hello, 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 hello. Good morning, good morning, good morning from Sacramento, California. How are you guys doing? Thank you for tuning in. This is the day 5 out of the 7-day campaign for fundraising for COVID-19. Thank you so much for tuning in. And today we have a very special guest. I thought every day I've been talking by myself. So I just wanted to make sure that what I'm talking is right. And I also want to make sure that somebody else approves it so that you can have a second opinion of my opinion. That's how I usually think like this. So today we have a very, very special guest. His name is Dr. Parimal Bharucha. He's my colleague and he works here in my hospital. He's the pulmonologist, the lung doctors. He's the most sought after specialty after this COVID-19 hit in March 2020. So he has been like extremely busy, and he was so kind enough to spare some time for us to talk about what happens when COVID infects lungs, and more importantly, oxygen concentrators. That is what we have been dealing with for the last like 1 week. To be honest, I myself was not completely aware of what an oxygen concentrator is and how people usually use it. So as you know, if I don't know, I will get some answers for you from other people who knows it, right? So that is why I'm bringing a specialist like lung doctor who uses this oxygen concentrator on a regular basis for his non-COVID patients as well. So this oxygen concentrator is not only for COVID patients. So let's see what he has to say so that we can get educated more on these oxygen concentrators. Let's welcome Dr. Bharucha. This is the first time I'm interviewing on this app. Good.
Hello.
Hi, Parima. How are you?
Hello. Good morning.
Good, good. Oh my
So
God.
clearly you can hear me. So let me correct you, my friend. I don't work in your hospital. You work in my hospital, okay? I have been there way longer than you are.
Right, right. Which means that he's so senior to me.
I'm elderly. I am elderly.
So,
So
so thank you so much for joining. I know he has to leave in half an hour to ICU patients because he starts his shift at 8 a.m. So he's so multi-talented that he gives live show from 7 to 7:30, and from 7:30 to 7:45 he gives phone consultation, and 7:45 to 8 he prepares for his patients. So, but anyways, thank you so much for joining. So, all our audience are eagerly waiting to hear from you about what is oxygen concentrator. Let's start with that. What is
all
an
right.
oxygen
So
concentrator?
let's start number one with COVID. So as we all know, COVID is a respiratory illness, and the other name for COVID is SARS-CoV-2. SARS is spelled out as severe acute respiratory syndrome. So that means that COVID can cause severe lung disease. And when that happens, it makes your lungs very stiff, which will ultimately affect your breathing pattern and the oxygen exchange, i.e. that your oxygen level drops down. So, of course, what you will have to do is provide oxygen. For example, if you don't have enough thyroid in your body, you take thyroid pills, right? So it's the same thing. If you don't have enough oxygen, you take it from outside. Now, how this oxygen gets delivered to you, it's a question. There are two main forms, or three main forms rather. If you're in the hospital, you can get it through the pipes, like you have gas, like the gas connections at home. Initially used to have cylinders. Now you have gas pipelines. But those pipelines cannot be done at home for oxygen. So either you can use it in the cylinder, or you can use a concentrator. So what's the difference? Cylinder, as you all know, they show it in the movies, like the green tanks that you carry around. But again, because it is a chamber that has XYZ amount of oxygen, if you ultimately it will run out. But the concentrator, as the name suggests, it will concentrate the oxygen. The normal air that you, I, and everyone else on this earth breathes has about 78% nitrogen and about 21% oxygen. So the main job of concentrator is to concentrate this oxygen. The way it does it, that there is a compressor, the normal air will go through the compressor and it compresses the air, i.e. it is like a zip folder. You have like multiple folders and you compress it into a zip folder. The same thing, it will tighten the oxygen and the air into smaller particles, and it has something called a zeolite. Zeolite loves nitrogen, so it will pull the nitrogen out, i.e. now the air that is coming through, that's exactly correct. This is a big, ugly machine. Having said that, I mean, it is like a, I mean, you can color it like, when you get fracture and you have the cast on your hands, you can draw things on it and make it very colorful and cheerful. Having said that, yes, so the main purpose of this is take the normal air that is circulating in your home, pass it through the machine, get rid of the nitrogen. So now what you get out of the machine is the pure, about 96 to 99% oxygen, which is completely concentrated. So that is how it works. The benefit of this is that you plug in and you will never run out of oxygen. The problem with the cylinder is that once the cylinder is empty, of course, you have to refill it. And in today's day and age, where are you going to get it filled? So, so having said that, that's how concentrator works. As the name suggests, it will concentrate the air, so you don't have to purchase air from anywhere. It is, of course, it is in your house. And God is so nice that we are never going to run out of the normal air in the next, like, multiple generations after us. They will still have enough air to breathe and to concentrate. If I remember correctly, you had a session a few days back whereby you had said that, if a patient oxygen level is 92% or more, they don't need oxygen, and that is amen accurate. Unlike I cannot speak about your aunt who wants to hit a century. Having said that, what I would want to tweak a little bit is that patients, when they are diagnosed with COVID, yes, they will all buy a pulse oximeter, as you had suggested, and most of them might be doing it. To keep a trend of your oxygen levels is very important. For example, you got diagnosed with COVID today and your oxygen level is 98%. And 3 days, 4 days from now, if your oxygen level is dropping and it is hitting 92%, yes, you do not need oxygen, but that should be a warning signal that your oxygen level is dropping. No matter what you do, no matter how you feel, it is dropping. And so you should seek help from a physician. Now, in my practice, usually for all my outpatients, whether they have COVID or they have COPD, which is any other type of lung disease, we all, including you and I, we can survive normally, and we will not be goofy, i.e. our brain still, it will be intact as long as our oxygen level on the pulse oximeter is 88 to 89%, which translates into, if you do ABG, because nowadays everything is blood work, like the CRP that we all keep on talking about. So on the ABG, if your oxygen in the blood dissolved is 59 and above, I think you are safe. So it's just important that if your oxygen level is dropping,
ABG,
then yes, you want to do.
Let me just clarify. ABG is the blood work. So you.
ABG is the blood work. You prick your artery. It's arterial blood gases. So it is freaking painful and it hurts. And if you do not go to somebody who knows what they are doing, then probably you will end up in a more problem. Having said that, I just brought it up because there might be some question, because Google is God nowadays, and CRP and D-dimer is God. So yes, why not throw some PaO2 levels in there? But the most important thing is the pulse oximeter. Keep it, and don't go crazy about it. You don't have to keep on checking it freaking every minute of your life. 3 to 4 times a day is great, and or while during exertion, like keep a walk around in the house. I'm not going to tell you to go outside if it's a crowded place like Delhi or any other major cities. But if you have enough space to walk outside or in your home, then keep the pulse ox on your finger, and make sure that your oxygen level stays at least 92%, during exertion.
So the finger doesn't matter. I have asked this question before as well. That doesn't matter which finger, right?
Doesn't matter which finger, or you can even use it on the earlobe. In the hospital, sometimes we put it on the earlobe, because anything that has a blood circulation, which is like a dead end, then you can use it. You can use it on your toes as long as they are not colored. All these females, hopefully nowadays they're not putting on a lot of makeups and the nail polish. But sometimes the nail polish, if it's a red one, it might interfere with how the pulse oximeter works, and you might get a false low reading, and then you'll be like, oh my God.
I think it's a very good point. Like if 4 fingers you have nail polish, put the pulse oximeter on the 5th finger. That's number 1. Number 2 is if you can also compare whether the oxygen levels are equal by putting the pulse oximeter on the earlobe, and then whichever is higher, you could go with that number.
Yes, higher is better.
And the third thing that Dr. Parimal Bharucha mentioned was it's absolutely important to see a trend and just
Trend.
not the single number. So if you have 98 before, if it trends down to 92, then there is an issue. But if you're 93 already, and if it is 92, then it is not a big problem.
Correct.
Okay, super, super.
So again, not everybody has to buy an oxygen concentrator, because not everybody needs oxygen. And again, there is a limitation, right? I mean, as we had been talking about in the past, mild to moderate disease, you can take care of it at home. But I don't want people to take home a message that, oh my God, now we have to buy an oxygen concentrator. No, you don't have to buy an oxygen concentrator. If you need oxygen, and if you can afford a cylinder, then that's fine. They're both exactly the same oxygen. The amount of purity is same. It is just the question of that the cylinder is going to get empty versus the oxygen concentrator. As long as you have plugged it in, it's going to work.
So, one other question is, let's say that, my family member is infected with COVID. And given the lack of oxygen cylinders back home right now and inadequate supply, people here in the United States are jumping to send oxygen concentrators home. I think there is I was involved in a fundraising campaign as well to send oxygen concentrators. So you were saying that oxygen concentrators is important to keep it, or doesn't matter and seek only when oxygen levels goes down?
Seek only get it when the oxygen level goes down. As I said, because then otherwise you'll start hoarding, like, in the initial phases, 16 months back, we used to hoard the toilet paper and the sanitizer. I don't want people to hoard the concentrator just in case if I need it, because yes, if you do that, luckily you might have money, or you might sell whatever jewelry you have, and you'll buy a concentrator. But think about this, that someone else might need it.
They're
Much
hiking the
more
price
important.
like crazy as well. They're hiking the price of this
Of
oxygen
course,
concentrator.
yes. Right. So, use common sense, and think about community, right? Because at the end of the day, if only I survive and there is nobody else, everybody else is dead, hey, what's the point of me using concentrator, right?
Yeah. So as you said, 85% of the people do get better without oxygen at all.
That is correct.
Yeah.
But
And
it
the
all
only
depends upon, sorry to it all depends upon what your risk factors are, right? I mean, for example, if you have underlying CAD, which is coronary artery disease, diabetes, high blood pressure, then probably you will be amongst those people who might get more severe COVID and might need more oxygen, or your chances of requiring oxygen will be higher. But yes, not everybody needs oxygen.
Right. And besides COVID, what are the other diseases that you usually recommend oxygen cylinders or concentrators for?
Oh, so COPD, which is nothing but the lung disease related to smoking. It is the most common reason why the lungs fail. And actually what happens in that disease, it's very good. Okay, so in COVID, usually what happens is that let's talk about this. You have your lungs.
I just love this. That's why I brought you in. You bring in like two answers to one question.
That's great. So you have your lungs, you chop it, cut it, slice it, put it under the microscope. What you will see a bunch of grapes. This bunch of grapes are called alveoli. Alveoli are what helps us exchange oxygen and carbon dioxide. Yes, you do have a trachea, which is a breathing pipe right in the middle of your neck, but that is a freaking useless thing. It's called a dead space. It does not per se help in any way, shape, and form with regards to oxygen or carbon dioxide. So in COVID, what happens is that this alveoli, they collapse. It is like you put a bunch of grapes in the salt water, and the grapes become raisins, the dry raisins, right? Right. That's what it is. Versus in COPD, this grapes, they become like watermelon. So so that's the main difference. Having said that, what happens ultimately? Your oxygen drops, and it is like a Ramban Ilaj. That is Tylenol works for everything, which is paracetamol or Dolo 650. Same thing. Oxygen works for both these conditions. You can also have COVID right now. It is in the acute phase, so there is a lot of inflammation. Now, every inflammation has to heal. Sometimes it heals without scars. Most of the time, it will heal with scars. The scars on the skin you can see, but the scars in the lungs, they are called fibrosis, which means that the lungs will become very stiff. So again, when you have stiff, then your alveoli or the bunch of grapes are not normal. They shrivel, they go down in the numbers. So there is less exchange of oxygen and carbon dioxide. So you will need oxygen at that time. The other thing would be if you're very bad asthma, if you have, for example, very bad heart disease, heart attack, congestive heart failure, then you will need oxygen.
Right. So, you are the lung doctor. You've been seeing so many COVID patients more than me for the last 1 year. There is this big thing about checking C-reactive protein either before COVID-19, I'm sorry, before vaccination to see whether you have any heart problems or during infection to maintain to see what is the level of inflammation. Please comment on these two topics.
I guess I should have I should have bought some stocks for people making the CRP labs, right? I would be so rich. No, having said that, the C-reactive protein is nothing but it is it is a rich men's marker of inflammation. You can get the same information if you do a routine CBC, and you can get platelets. If the platelet count is high, of course you know that there is inflammation. Now, the CRP, which is C-reactive protein, there are different types. One is the inflammatory and one is the cardiac. So if you do the cardiac one, which has nothing to do with the COVID, in the COVID you usually do the inflammatory marker. That just tells us that if there is inflammation or not. Again, with any numbers, trend is important. Having said that, if you come to me and you have fever and you have been exposed to COVID, you walk like a duck, talk like a duck, fly like a duck, swim like a duck, you have duck, whether I prove it or not. So if you have COVID, I really do not need a CRP to see how you are doing. Like, for example, right now you're talking to me on room air, but say 2 days down the road, now you are on 100% oxygen. Do I really need a CRP to tell you that, yes, you're freaking very inflamed? Absolutely not. It's a waste of money. Especially if you are going to get vaccination, how does it matter whether your CRP is 0, your CRP is 100? Number one, it does not preclude you, does not contradict you or make you ineligible for the vaccination. Number two, it is not going to cause you a heart attack if you get a vaccine with a high CRP. Yes, if you're very athletic like me, I mean, sitting in front of the computer all day long and having a food baby, and your cholesterol level is high, then yes, I don't need a CRP. Of course, I'm going to have a heart attack down the road, either today or 1 year from now. Doesn't matter when. But yes, so I would say that don't waste your time, don't waste your energy, and don't get panicked with the CRP. Oh my God. And then, of course, there is always that one CRP will be high, and then you do it 2 days later and it is very low. And the third day again, you do it and it's high. And it's just confusion and nothing else. And don't waste your money and time and energy. No.
Right. So I think we have been discussed in the channel before that C-reactive protein doesn't help a lot. The main concern was there was the South Indian actor who died after 24 hours of vaccination, and that created an anxiety that vaccination causes heart attack. And then the circulating news in WhatsApp was, please check a C-reactive protein before vaccination to see whether you have heart disease. So
No, you don't
summarizing
have
what
to.
Bharucha said, there are two kinds of C-reactive protein. One is the heart-related C-reactive protein, and the second is inflammation related C-reactive protein. So what he is saying is both are useless pretty much. And if you have CRP is elevated, and you could also see that you have some kind of risk factors for heart disease if you have diabetes, hypertension, obesity. So you necessarily don't have to have C-reactive protein. Okay, super. The one question from the audience is, people are talking about prone ventilation. So people, they are actually lying on their stomach for 12 hours thinking that they will not get COVID-19. There is some kind of scientific evidence to it. Why don't, as a pulmonologist, explain to us, please?
So a prone ventilation and or that you lie on your belly. That is not new. It is nothing specific to COVID. We have been doing it since, oh my God, 2004, when I once upon a time when I was a
But
medical intern and a resident.
you are
Yes.
not that young.
So prone ventilation is not new. It is not specifically developed for COVID. And number two is that it is not going to prevent you from getting COVID. It is like vaccination. Yes, vaccination is going to prevent you from getting much more sicker if you get COVID. It does not say you are not going to get COVID. Same thing with the prone ventilation. It is not going to prevent you from COVID, but what will happen is, do you want me to share my screen? My screen would be bigger, I guess.
I'm trying to use my limited technology skills here.
Okay, so that's fine. So the first part of this is that, let me show you. Hold on. Can I share my screen?
Yes, yes, yes. Let me
Okay.
stop sharing my screen 1 second. Yeah, go ahead.
Okay. Let's see if I can handle it.
So you're proving that you're more technically efficient than me.
Okay, can you see my screen at all or no?
No, not at all. Which means
Oh
I'm better.
man. Okay, Chrome has lost permission to capture your screen. Oh, forget it. Okay, that's fine. You can go ahead. I was just going to show you a screen about what is prone positioning. It's very simple. You lie on your belly. Again, there are no contraindications. Even if you have a big belly, you can do a pendulum swing, and that is fine, like a seesaw. It is okay. The big belly is not a contraindication to sleeping on your belly, except that yes, if you have eaten a lot of heavy meal, then you want to wait a little bit longer before you sleep on your belly. Otherwise, with the pressure on your belly, oh god, I do not want you guys to throw up. Having said that, the only contraindication of sleeping on your back would be if you have any kind of spinal problem or unstable spine, or if you're coughing up blood. Other than that, there is no other contraindication, or there is no other reason why you should not sleep on your belly. Now, having said that, you can show the picture back again. That's fine. The first part of the picture is supine. Supine, i.e., is you are sleeping on your back. In simple words, you are sleeping with your butt on the bed. So what happens is that there is always pleural pressure. We can make it more confusing, right? I mean, to sound smart, but we don't have to. We can keep things simple. So the lungs have the anterior part, which is the front of your chest, and the back. There is a lining called the pleura, which is a very thin lining. The pleura is the one that has a lot of electric circuit, and our lungs hurt sometimes when we take a breath in, because the pleura is inflamed. The lung per se, you can stab your lungs 1,000 times and nothing happens, because lungs have no electricity, no nerves. But it's mainly the pleura. So there is something called a pleural pressure, and the front of your chest has a different pleural pressure, and the back of your chest have a normal pleural pressure. The difference is called the transpulmonary gradient. Now, normally, the pleural pressure anterior on the front of
Parimal,
your chest, yes.
even I don't know what transpulmonary gradient is.
That's what I did not say. I said that there is a difference between the anterior part of the lung and the posterior part of the lung. Okay. So now, having said that, so normally what would happen is that if you're lying on your back, you take a deep breath, because there is less pressure in front. The alveoli in the front of your chest would be bigger than the back, because your back is getting squished,
So
because you are
this is
the
the
back.
alveoli.
That is the alveoli. And so that is correct. Now, that alveoli is a little bit rounded, which means that it is over distended. And if you see the alveoli on the back, then it is like a raisin. The reason is that because the gradient on the back, or the pleural pressure on the back, is higher. And so air likes to go where there is less pressure. Like, for example, in your house, the warm air will go on towards the ceiling. Same thing, if you have a balloon, the balloon usually goes up to the sky, because there is air. Air is lighter, so it tends to go towards the upper part. So what happens is that the anterior part, or the part of the lungs towards the chest, yes, so that gets over distended, and you see the lower part is squished. Now, where will the blood go? The blood goes towards the dependent part, right? So the blood is flowing towards the part which is not very well oxygenating, or not very well ventilating. So that is what we call as VQ mismatch, or that there is a mismatch between the amount of air and the amount of blood. And so if you see on the side section, the first part of that picture, the other side, towards no, the first part, the upper part, yes. So there are two different colors. The pink one, the 3/4 of the lungs are pink, which is good. That is well oxygenated. Yes, so those are called atelectatic lungs. Now, that's where most of the blood is going. That's where there is less oxygen. So that's
so in this picture, the pink is good.
The pink is good, right? Yes, which is well
the purple
ventilated.
is not good because there is no ventilation.
There is barely any ventilation, but where does the blood go? The blood tends to go to the dependent part, which is on the bed. And so that's where the blood is going. So it is like wastage of the blood flow, because it is not picking up enough oxygen. So of course it is going to circulate, the blood is going to circulate in the body with air, which is not with not well oxygenated blood. Having said that, now if you flip them, flipping them, it is, if you are awake and alert, it is called awake proning, and that is what we have been recommending for the whole year and a half now. Then it's very easy for you to sleep on your belly. Having said that, if you do not if you do not listen to us, and if you end up on the ventilator, then guess what? Like 5 or 6 of us will drape you, and then we'll have to flip you for 18 hours. Versus that, if you can do it yourself, then you can do as long as you can, and then you get tired of watching Netflix movies, then take a break, walk around, and then come back, have food, and then watch another show, and then go back on your belly.
So let me just stop you right there. So you're saying that, I know that if they are ventilated, when they put an artificial breathing machine down your throat, I know that prone ventilation helps. So you're saying that even with mild and moderate disease, prone ventilation might help as well. Is that right?
Not might. It does.
It does. Okay.
Yes.
It does.
Might is still you are not sure. No, it is 100%. It helps.
Okay.
It helps. And the way it helps would be that it will. Okay. So now when you flip the body, now if now the patient is sleeping on the belly. So see what happens, that the part of the lung, the alveoli that was squished in the above picture, now it does not have the pressure on it, and so now it is actually more ventilated. And the part of the alveoli that was over distended, now because it is lying on the bed, there is some pressure. And so instead of over distension, it is getting normally distended. So now what happens is that the blood is flowing to the part of the lungs, which is normally distended. And so that VQ mismatch that we had in the first picture is gone away. And so if you do the cross section, look at that. There is only so tiny little part which is atelectatic, right? So therefore, that is how it helps, that it mainly reshuffles, or it mainly changes where the air is and where the blood is. So it makes them more symbiotic relation versus love and hate relation.
Beautiful. We only have 3 more minutes for you to leave. Just one more important question about your take on remdesivir. When do you use remdesivir?
So I heard something. I'm Gujarati, and you always take some things from me. So remdesivir, right? So if you think about this in the Indian version, how will you spell it? Remdesivir. So Ram is Lord Rama. Desi is, of course, we are all Desi. And Veer is strong, right? But that's not true. You can break it apart as you want. But remdesivir is, why am I saying remdesivir? Shut. Remdesivir. So remdesivir. Okay, if you get it, well and good. If you don't get it, don't sweat about it. Again, all the studies, including us, even today, we only use it if you will show up to the hospital within the first 10 days with mild to moderate disease requiring 2 to 3 liters oxygen. If you're requiring more oxygen, or if you're already on the ventilator, if you've crossed 10 days, then we don't waste it, because it does not help. Number one, it will not prevent you from dying. That's well proven.
It does not prevent death.
Correct. And number two, it is an antiviral. So the thinking would be that if you give antiviral during the acute phase when you have a lot of virus, then probably it will kill the virus, and probably the duration of your symptoms would be shorter.
It does not kill the virus completely. It just decreases the replication.
Correct. So, but if you're already 10 days into this, then your viral load already is gone. So then why waste it? That's the reason why we do not give a patient remdesivir after 10 days of symptoms, because if you go through the curve.
10 days of symptoms or 10 days of being positive?
No, symptoms.
Symptoms. Yeah. Right now.
Yeah. 10 days of symptoms from when you started, because who knows when will you go and get the testing done, right?
And that within that 10 days, if you are completely asymptomatic, or if you're mildly symptomatic, you don't even have to use remdesivir, because it doesn't help a lot.
No. Only if you're symptomatic needing oxygen, then maybe it will help by cutting down the number of days that you are going to spread the virus, or that you're going to feel sick. Again, Tylenol would help. So who knows if your symptoms are better from Tylenol or from remdesivir, right?
Right. Exactly.
Having said that, so if you don't get remdesivir, if you don't get oxygen concentration, amen, good luck. Don't worry about it. Just keep on doing what you are doing, and breathe in good air.
So people are standing in line to get remdesivir. They might get COVID while they're standing in line rather than getting remdesivir.
And who knows, you are getting remdesivir or not? You might be getting some other god instead of Ram.
Right. It may be, sometimes it may be just filled with saline solution.
Correct.
Yeah, you don't even know. Yeah. So anyways, for the audience, the main important point is, please don't spend too much time and money on remdesivir. It's only indicated in small subset of patients, as Dr. Bharucha said. Perfect. I think you made the day. I promise that I'll leave you in 30 minutes. Thank you so much for joining, Parimal. Thank you.
Of course. Thank you. Bye-bye.
Thanks a lot. Yeah. All right, guys. So I think I just wanted to give you a second opinion about, what is about remdesivir, prone position, oxygen concentrators. Hope that helped a little bit. Let me just do a rapid fire questions as much as possible, and then we will wrap it today, and I will see you tomorrow as well. Please consider donating to Aishwaryam Trust. As you know, we are doing this fundraising campaign, and the whole channel, Dr. Pal proceeds, will go to Aishwaryam Trust because we have been running this for the last few years. This trust is mainly for hospice or palliative care patients where they don't have anybody to fall upon, or even from a medical standpoint, we have exhausted all the options and we have given them a death sentence of 6 months. If people cannot live more than 6 months in India, we don't have any insurance coverage or any hospice care support, and that is why we are promoting this Aishwaryam Trust to provide free care to hospice and palliative care patients. We have a 75-bed hospital right now, so we are planning to expand it more in due course of time with your help as well. So as the channel grows, all the proceeds will go to Aishwaryam Trust. All right, let me take some questions. Hi Upanisha, asthmatic for the past 10 years, thrombosis due to oral contraceptives. So you are at increased risk of blood clots. Which vaccine should I opt for? If I was you, Upanisha, I will not get Covishield or Johnson and Johnson, because those were the two vaccines or increased risk of blood clots. It is 1 in a million. It is rare. But if you have an option of to choose between Covishield or Covaxin, I'll opt for Covaxin. But if you don't have an option, I will definitely get Covishield as well because the risk is extremely low. So hope that answers the question. So Savitri, new variant Covaxin Adhiga Bala என்கிறார்கள். Yes, that is what has been proven right now, that Covaxin slightly covers more than Covishield. Hopefully, we will have some data for Covishield pretty soon as well, but at least on the lab studies, looks like Covaxin is slightly more effective, but doesn't mean that you have to wait for Covaxin. Please get the vaccine, whatever is available to you. Hi Tina from Tampa. நீங்க மதுரை தானே? ஞாபகம் இருக்கு, நீங்க முன்னாடி ஒரு தடவை கேள்வி கேட்டிருக்கீங்க. Covishield, as I just said, we just don't know enough data, but in theory it should work, Tina, so I will not be too much worried about it. Heart patient corona vanda 2 மாதம் ஆகிறது, mild symptom. Usually you recover if you get vaccinated. The recovery is absolutely good. Jyoti donate, felt good. Exactly. We will feel good. If you donate something to a cause that you know that it is trustworthy and noble, you will definitely feel good, and this will definitely help you down the road as well. You are helping some patients, some older patients who don't have anybody to help. We just don't know how privileged we are. We don't appreciate what we have. Start appreciating what we have. The life will be beautiful. My mother has taken a second dose of Covishield. Can she travel? No, travel to 2 weeks after Covishield. That is what I would recommend. With this current India situation, travel only if it is absolutely needed. So Shrikant, as you said, Covishield did not work. I did not say Covishield did not work. I just said that Covaxin and mRNA vaccines have been shown to be better protected against Indian variant. Covishield lab work is saying that yes, there is some protection, but the data is not there yet. It remains to be seen. So maybe with this information, we could just be a little bit more cautious in social distancing and general preventive measures. But doesn't mean that Covishield will not work. We just don't know yet. Due to acute shortage of Covishield, it is already taken before 90 days once supply is streamed. Absolutely. That is what these people are doing in Canada and UK. They're even taking after 4 months. You will be completely okay. Don't worry too much about it. I'm Nakiran from Chennai. CRP test required before getting the vaccine. Hopefully, we answered your question. If COVID-19 patient got a vaccine, what would be the side effects? Nothing. Don't worry too much about it. Even if you're asymptomatic, positive COVID-19, if you get vaccine, nothing will happen. When we are saying that get the vaccine 2 months after your initial infection, it just means that you can extend the antibody level a little bit more, because the natural immunity maximum lasts for 2 to 3 months. That is why we are saying that. So hi Mohan, people who are vaccinated, can be positive. Vaccination does not prevent death. Vaccination, I'm sorry, vaccination does not prevent COVID-19. It prevents death. So when you are vaccinated with COVID-19 vaccine, you can still get exposed to COVID-19. You can still get COVID-19, but the likelihood of that progressing to severe disease and to death is almost close to zero. So that is why we are saying. So, Madhuri, my daughter, 8-year-old, wants to donate her savings to Aishwaryam. Wow. Wow. Good. Man, you made my day. Madhuri, super. Very, very congratulations to Shivika. Shivika, remember that maybe from now, 1% of whatever you earn, just give it back to the community. It will help you down the road, Shivika. Wonderful effort. Let's give a huge applause to Shivika. That's a very, very good gesture. All right. Usha Rani, allergic to cephalosporins, got COVID vaccine. The doc in the center told her not to take COVID vaccine. ஐயோ சாமி கடுப்பேத்துறார் மை லார்ட் அப்படிங்கிறாங்களா இதான் யார் இது சொல்றது இந்த மாதிரி வந்து தப்பு தப்பா சொல்றதுனாலதான் இந்த மாதிரி ஃபண்ட் ரைசிங் கேம்பெயின் நீங்க எல்லாம் என்னை டெய்லி பார்க்க வேண்டியது இருக்கு யாராவது வாட்ஸ்அப் மெசேஜ் எல்லாம் இந்த மாதிரி தப்பு தப்பா ஃபார்வர்ட் பண்ணாட்டி நீங்க என்னை பார்க்கவே தேவையில்லை இல்லாட்டி நான் டெய்லி காலையில உங்களை வணக்கம் அப்படின்னு வந்துருவேன் ஸோ அதனால என்னைய நீங்க பார்க்க வேணாம்னு நினைச்சீங்க அப்படின்னா வாட்ஸ்அப் மெசேஜ் எல்லாம் நம்பாதீங்க போய் வேக்சின் போட்டுக்கோங்க அலர்ஜிஸும் கண்டிப்பா வேக்சின் போட்டுக்கலாம் ப்ளீஸ் ஒரு ஹாஸ்பிட்டல்ல போய் போட்டுக்கோங்க ஸோ தட் இந்த ஒர்ஸ்ட் கேஸ் சினாரியோ 1 in million ஏதாவது ஆனா கூட டக்குன்னு நம்ம வந்து உடனே வந்து காப்பாத்திடலாம் ஸோ அதனால வந்து தயவு செஞ்சு அலர்ஜி ஹிஸ்டரி தயவு செஞ்சு வேக்சின் போட்டுக்கோங்க அதுல ஒரு வீடியோ நான் பண்ணிருக்கேன் ப்ளீஸ் லுக் இன் டு தட் ஆஸ் வெல் so okay so maybe we'll just extend the session to like 3 more minutes because of the live question answers what we have now. So if we require oxygen, how will we handle the situation? It is extremely pathetic. The pictures that we are seeing is absolutely incredible. I just can't believe what I'm seeing. It's easy for me to say here from standing from things will get better, but I totally understand what people on the ground are going through. But my only suggestion to handle the situation is to stay home. I think India should be in complete lockdown. I know there are financial implications to it, but in my opinion, it has to be in complete lockdown. Nothing should come in right now. That is the only way to come out of this pandemic until vaccines come in. It looks like Covishield, Serum Institute of Hyderabad was saying that it will be released in July. July is like 2 months from now. I just don't know what to say. So my only suggestion is to stay safe, stay home, don't get exposed to COVID-19. Varicose veins, yes, for sure. Raju, daughter of allergic to egg and cheese, can she take Pfizer vaccine? Yes, here I think it is okay to get it in a fairground setting because like the rapid response team is right there. So I said hospital setting for India where they used to do mass vaccination even in like a primary healthcare center setting. So if you have history of allergies, I think it is reasonable to take that extra caution to set in a hospital setting. What are the possible reasons to be unfit for vaccine? Only if you send those WhatsApp forwards. There is no other reason I could see that you will be unfit for vaccine. Everybody should get vaccinated. That's the only way out of this pandemic. I keep repeating that again and again. COVID test negative, CT scan no specific. Okay. All right. So Arunan, please do me a favor. Please do me a favor. 100 degrees, it will get better. I can guarantee you that 2 to 3 days will get better. Or if not, then we will do a CT scan after. But please don't get CT scan right away because that is going to hurt you. That is going to hurt you. I'm telling you, based on the profile picture, you look very young. Radiation from one CT scan is equal to 300 chest X-ray. Remember, 300 chest X-ray. I'm as a doctor, when I do procedures, I take X-rays to see where my scopus, where my endoscopus, and all those things. So each and every time they take an X-ray, I get radiation. So I use a dosimeter. It's like a small clip-like thing, a device that I clip onto. It documents how much radiation that I'm experiencing every time I put I do a chest X-ray. I do an X-ray for the patient. So if I have a dosimeter as a doctor, when I'm getting an X-ray on a patient to document the amount of radiation coming to the body, just think about how many people are actually getting so much radiation with the CT scan, which is equal to 300 chest X-rays. This radiation is not without any side effects. It can cause cancer. It will not cause you right now. It will cause down the road, like 10 years down the road. And people will say, oh, பாவம் கேன்சர் வந்துருச்சு அவனுக்கு, என்னன்னே தெரியல இல்ல தெரியும் நமக்கு. 10 வருஷம் முன்னாடி நம்ம அடிக்கடி சிடி ஸ்கேன் எடுத்திருக்கோம் for nothing with COVID-19. Yes, CT scan has its role, but not for everybody. Please talk to your local doctor. Please double check, triple check whether you really need a CT scan or not. Yes, if your oxygen level goes down, if you are really symptomatic, if the fever doesn't come down, then that makes a sense. It doesn't make any sense to take the CT scan right away with like mild body pain. No, please do not do that. Okay, I'll take one last question and I will wrap it up today. Super question. Geeta Srikanth from Trichy. There is a top tablet called Clavira for COVID approved by Ayush. நமக்கு ஆயுஷும் தெரியாது, நமக்கு கிளபிராவும் தெரியாது. நமக்கு தெரிஞ்சதெல்லாம் வேக்சின் மட்டும்தான். ஆனா இதை நம்ம சொன்னா பைத்தியக்காரங்கிறாங்க. The Clavira, okay, to be honest, I just don't know a lot about Clavira. Maybe it is a good drug. Maybe it will prevent COVID. Maybe you don't need vaccination. Maybe it will prevent death. This is the wonder drug. I have seen so many WhatsApp forwards on this. So I don't encourage all this because I need scientific data, right? I need scientific evidence that this works. Not only in Indian population, it has to work in multiple other population. It has to be a well-designed, randomized, controlled study to prove that this works. Are you against Clavira? I'm not against Clavira. If that works for you, well and good. Please take it. But I personally cannot recommend it because I don't have any scientific data to any good scientific data to follow upon. Will there any have side effects to it? I don't know. They are promoting that there are no side effects, but nobody knows because there is no good data to it. But personally speaking, I have seen so many patients with liver problems being affected by all these over-the-counter medications because we just don't know whether this will cause any problems at all. So long story short is, if you believe in Clavira, I'm okay with it. Please go ahead and take it, but I cannot recommend personally. And also, please make sure that you monitor for any other side effects. Most common side effect that I've seen in the past, not with Clavira, with other over-the-counter medications, is sometimes it can cause liver damage. So if you have any problems with liver to start with, I will stay away from Clavira as much as possible. I hope this session was informative. Please consider donation to Aishwaryam Trust as well. We have 2 more days of this fundraising campaign. Tomorrow, I might be touching upon COVID infection causing myocardial infarction, heart attack causing vaccine causing heart attacks. All those myths will be debunked. I'm planning to invite my friend, Dr. Pavan Hari, who's a cardiologist based on his time. On the day after, we have a very important and an interesting discussion with Dr. Neha Paranjpe. She is the infectious disease specialist dealing with COVID-19 throughout the past 1 year. So it will be better to get some inputs from them as well. I hope this interview with other doctors will help you. Please leave in the comment section whether you like this interview session with other doctors. If you like this, I can bring in more doctors as well. That is the one thing I can do, so that not only my opinion, other opinions can also be shared through this channel to all the audience. Anyways, thank you so much for your support. Stay safe, get vaccinated. I'll see you tomorrow morning. Bye bye.